Good morning, everyone. Thank you so much for coming today, and thanks to Dr. Joseph for having me. I know she's been doing this conference for a number of years, and I've gotten to know Dr. Joseph really well in the last year, and she's extremely dedicated, and it's an honor for me to work with her. All right, so today I'm going to talk about disparities in breast cancer. You guys may have heard a lot about disparities, but I thought I would start by just defining what we mean when we talk about disparities. So the National Cancer Institute defines health disparities as adverse differences that exist among populations in cancer incidence, that's new cases of cancer, cancer prevalence, cancer death, cancer survivorship, and the burden of cancer or related health conditions. And when they talk about different groups, these groups can be characterized by age, disability, education, ethnicity, gender, demographic, geographic location, or race. So basically, we're talking about significant differences in health outcomes between different groups. Unfortunately, for cancer, it's a perfect example of a health disparity. And what this graphic here shows is that this is from the American Cancer Society, and it basically shows that blacks are much more likely to develop cancer than any other group, and also likely to die from cancer than any other group. So that is a disparity where there are different outcomes among different populations. Looking specifically at breast cancer, this graphic shows the incidence of breast cancer by race. So the yellow line is whites. This second green line here is all races. Blacks are the red line. The purple line is Hispanic. The blue is Asian Pacific Islander. And the greenish line here is Native American. And what we see is that whites generally have the highest incidence of cancer of breast cancer in the U.S., meaning that they're the most likely to get it, and blacks are slightly less likely to get breast cancer. Unfortunately, though, blacks are head and shoulders above everyone else in terms of who dies from breast cancer. And as we see, even though the death rates have declined somewhat for everyone, right? This line here is all races, right? We see that the death rates have declined faster in some groups compared to others. If you look really closely, you see that the gap between blacks and whites in terms of death from breast cancer is actually slightly widening, okay? Rather than closing, it's actually widening. So what are some of the reasons for that? So this is another graphic that just kind of puts the incidence and the death rates from breast cancer all together, and this is from 2006 to 2010. And so we see very clearly that whites have the highest incidence, which is this purple bar here, and this gray bar is death from breast cancer. So even though blacks have a lower incidence, they have a significantly higher death rate, about 50% higher. These disparities persist not only in terms of people, in terms of people dying from cancer, but even in terms of 5-year survival for breast cancer. When we look at this graphic here, which shows 5-year survival by race, we see that pretty much everyone is above 80%, except for black women. And again, this is just another way of looking at it, comparing blacks to whites. And you see from 1977, 1975, all the way through to 2009, basically this gap has not closed. So what are some of the factors that contribute to the disparities that we see? So differential socioeconomic status. So even though large studies have shown that people with higher income are more likely to get it. It turns out that people who have lower socioeconomic status are more likely to die from it. And unfortunately, in this country, blacks tend to have lower socioeconomic status. That can often result in disparities in medical access, in terms of screening, in terms of treatment. We still know that in many places, not necessarily New York City, but in many places in the U.S., black women still do not get screened in a timely way and are often diagnosed with breast cancer at a much later and more difficult to treat stage. So that's something that we can actually do something about. But what's also a very important contributing factor is this third point, a higher incidence of triple-negative breast cancer. I don't know if you've talked about that today, but triple-negative breast cancer is a particularly aggressive form of breast cancer that's basically characterized by the lack of certain receptors that are associated with good prognosis when it comes to breast cancer. We believe that this happens about 3 times more commonly in black women for reasons that we don't currently understand. It tends to hit women when they are younger. Also tends to recur more often. So it's a very deadly form of breast cancer that, unfortunately, black women tend to get significantly more than other groups. Other differences in tumor biology and the genetics of breast cancer that we still have yet to fully understand. There are many risk factors that are associated with breast cancer that involve lifestyle and reproductive history, as well as environmental exposure that may differ according to socioeconomic status. And then we know that obesity is associated with pretty much any cancer, but is associated with breast cancer. And we know that obesity is a major public health problem for everyone in the U.S., but particularly for black women. So here in New York City, this is a report from 2008 that basically looks at 3 major cancers in the U.S., and it basically compares the people with the lowest death rate from that currently, and then the people with the the population with the highest death rate from that. And then this number here is basically how many lives would be saved if we were to equalize that number and basically bring the population with the highest death rate, bring them down to equal the lowest death rate. And if we were to do that, we would save over 200 lives per year from breast cancer. And looking at all 3 of these cancers together, if we could equalize, right, if we could get rid of the disparities that we see, we could save over 1,000 lives per year, which is significant. Health disparities has been on the national agenda for quite some time, but the National Cancer Institute, which is the federal organization that really funds cancer research and keeps track of cancer outcomes of citizens of the U.S., they really care a great deal about providing the best outcomes for all. And the way to do that is to make sure that the people who are suffering the most, are getting the care and the attention that they need. And so they came up with a whole strategic plan to actually try to address some of the disparities that we see. And so their strategic objective number 8 of their big overarching strategic plan is actually to overcome cancer disparities. and they have several strategies here for how to do that. I'm not going to go through all of them, but some of the more important ones are understanding the factors that actually contribute to cancer health disparities, and working with communities to actually develop interventions that will improve both the prevention and the treatment of cancer in underserved populations. And I think that very much applies to breast cancer disparities. So some strategies for addressing disparities that there has actually been some work completed in, and I've actually been a part of some work looking at some of these strategies in other cancers that, and primarily in men, but I think that some of the lessons that we've learned can definitely be applied to addressing health disparities in breast cancer. So outreach, I think, is really important. Basically, community-based programs to try to identify unscreened women and to basically direct them to where they can go for screening. If we just focus on people who are in the healthcare setting, we're going to miss a whole lot of people, who currently don't regularly use medical care. Education, letting people know about the importance of timely screening, but also letting people know about the importance of following up abnormal screening tests. Here in New York City, we actually have fairly good screening rates compared to other cities in the U.S. For the most part, upwards of 70% of screening eligible women in New York City have been screened in the last 2 years. We would obviously like for that to be 100%, but 70+% in some neighborhoods is actually, in some neighborhoods in Harlem, it's actually higher than 80%. And so we think that here in New York City, screening could obviously be better, but we think that one of the major places where we're missing the boat is in following up abnormal tests. So if there is an abnormal mammogram or other screening tests, it's very, very important to actually go and get that test followed up with other diagnostic studies, and then to basically follow that through with the proper treatment. It's very, very critical. And so education is part of that, but also navigation is a very important part of that. Navigation is basically finding patients anywhere in the healthcare system who need help and basically guiding them to where they can find that help. And that can either be on the screening end, it can either be on the treatment end. And so in studies of navigation, particularly in minority populations, it's been shown to really improve outcomes greatly, not only for breast cancer screening, but also for breast cancer treatment, as well as other cancers. And so, one of the things that we are thinking about currently at NYU is how we can implement these three strategies together to identify people, educate them, and then navigate them to where they can get the proper care, and basically see them through, all the way through the process. We don't want to identify people who have cancer and then just leave them hanging. Well, we want to find a way to basically, once we find people and diagnose their cancer, to navigate them all the way through the process, either to treatment or to clinical trials. Sorry, it just went to sleep on me. So I think that conferences like this are crucial for us targeting and improving disparities as they relate to breast cancer. So thank you so much for your time and attention and for being here. I hope that that by the time I take my last breath, hopefully 75 years from now, that we will no longer be talking about disparities in cancer, that we will have leveled the playing field. So thank you all very much.